So for now, I would like to drill down a little bit more on some aspect of security that you guys as an IT personnel or even as a general user need to know. So most of you know about basic practices about username and password, right? For example, you all know that password has to be long enough. The current standard is 8 characters or more. It should be complex, which means that it should contain mixed letters, the uppercase and lowercase, and numbers and symbols. In some cases, the symbols were not allowed, and so in those situations, you need to have the uppercase, lowercase, and numbers all together. We all know that the password, in theory, should be changed every once in a while. The current standard is every 3 months for a critical system and every 6 months for important or for general system. So for healthcare, I would think 6 months is an appropriate period, although it's perhaps difficult to implement if you have to deal with users, human users. You have to allow for some process for them to adapt and adjust. But I would say 3 months for most systems would be quite challenging to implement because if you force them to change the password very quick, they would want to write down because they don't want to remember all the time. And so those are kind of a bit risky. Unless it's really super important, like very important financial systems or military systems, for example. Of course, we all know that you should not reveal your password to someone else. You should not write down your password. That's the clear screen policy. If you use a public computer, you should not click the enable or remember the password option and try to use different passwords for different accounts. And that's perhaps challenging in real life, but sometimes it's doable. Sometimes you can have a system for, if you use password for Facebook, perhaps you know that it should contain some characters that is different from your Twitter account, for example, so that if one password was hacked, they don't have full access to all your accounts across all the services. Now, for user security, we have some terms that are used a lot. For example, access control. Access control is actually how you selectively restrict access to the system. So you control how much access you give to a certain individual. Whereas the term role-based access control is you control the access according to the role of the person or the user rather than the identity. So not because I am no one, that's why I can access the patient's data, but because I am a doctor. And so I should be able to order the drugs and look at the history of the patients in the medical records, for example. And because I am an IT executive in my hospital, I should be able to access certain IT systems that typical doctors don't have access to. That's the concept of role-based access control. So it's not because of who we are that we have access, but it's because of what role I play. Okay? And then you have the audit trails, which is how you log how you people access the system, and so you can review and audit that later, and you can investigate if necessary. So going back to George Clooney's example of an employee, a hospital employee, looking at George Clooney's details of injuries, how the hospital was able to identify that person and investigate that was using audit trails like this, using the logs in the system on who accessed what. Then we have 3 processes related to user security. Sometimes you all have heard about identification, authentication, and the word authorization. How are they different? Identification basically means I identify who you are. So it uniquely identifies someone, perhaps using a user ID, an ID of some sort, or a username of some sort. That is simply to identify, but I have not verified whether you are the real you. Even though I claim to be number one in the system, I use my username. It doesn't necessarily mean that the identity is verified. So it's simply identification. But then you have another layer or level of security when you authenticate the users. So once I claim to be number one, but because I know the password, I can confirm, the system can confirm that the person who is really who he claims to be. Okay? Usually this is done by the keys, the PIN codes, the passwords, or some fingerprints or biometrics. And then you have the authorization, which is another level of security beyond authentication. So after you confirm your identity, then the system can determine what I can access, what I can do in the system, and what I cannot, based on who I am or what role I play. Okay, so authorization is verifying how much I have access and provide only that access that I have been granted to. So it depends on the policy of the organization. Again, authorization is where principle of least privilege comes into play, where you authorize people to access the system and the data only the least privilege or only to the minimum as long as they can do their job. Okay? So, but not more. You don't provide them full access if that's not really necessary to do that job. And actually there are other concepts in security as well, like non-repudiation. Non-repudiation is how you cannot really deny that you are the one who access or do something to the system. So basically it's proving the integrity and origin and whether who performs an activity and without that person being to refuse the actions. So it's like you sign a contract, it's your signature. So you can't claim later on that I didn't sign that because it's your signature on the contract. So the same thing can happen with a good design in the system. But that is perhaps more technical. This is where you use digital signatures and certificates, a concept that perhaps is beyond this talk, but you can look it up online on digital signatures, electronic signatures, and certificates, how you use keys. And one example is how you design a public key infrastructure, or PKI. It's a concept very close to encryption. Okay, so use cryptography and how you use encryption algorithms to help with non-repudiation. Now, going back to authentication, so in the past we used to authenticate ourselves or confirm the identity of ourselves only by one factor, which is by password or by something else. But these days, because so many passwords can be hacked, and sometimes we need more security, so we use multiple factor authentication. Most of the time we use two-factor authentication. If you use Facebook, if you use some other online services, they would have options for enabling two-factor authentication. So use multiple means to authenticate yourself. The concept is there are three kinds of factors. The first factor is something you know, like passwords, PIN codes. And you have something you have, which is like a key, a card, or a device, a token device, or a mobile phone where you can receive the one-time password or OTP. Okay? And something you are, which is your biometrics, your retina, your fingerprint, for example. The idea is if you want to use multiple factors, you should not use the same type of factor. You should not use a password and a PIN because it's the same thing. You should not use a card and a key because if you can steal someone's card, you can also steal that person's key as well. But if you use multiple types in a two-factor authentication, you need to know the password or guess or let the person reveal the password. But also you need to steal the person's key or the card as well. So let's say when I log into an online service and I type my password and it sends my OTP or one-time password to my mobile device. That's when something you know, which is the password, is used together with something you have. In this case, it's my SIM card because my SIM card number, the phone number, is registered on the online service. And so once they send that OTP to my phone, that proves that I have access to my phone that was registered and I know the password. It should be the real me. Okay?